report this morning pinpoints dangerous conditions that have apparently led to many deaths in facilities known as surgery centers across the U.S. The report by USA Today Network and Kaiser Health News takes an in-depth look at operations performed at these non-hospital facilities. It found more than 260 patients have died after surgery center procedures since 2013. Tony Dokoupil is here with what the investigation shows. Tony, good morning.
Good morning. A lot to this investigation. Surgery centers focus on routine same-day operations, and the industry says this can make for cheaper, faster, and more convenient service than in a hospital. But when something goes wrong during surgery, the hospital may be the safer option.
I said, go get him, bud. That's the last thing I said to him.
There was no reason for Scott and Sandy Veldhuizen to think they'd have to say goodbye when their 12-year-old son Ruben had his tonsils removed in 2016.
Our surgeon said this is not going well. She told us he had coded and they'd called the ambulance.
An ambulance because the procedure wasn't at a hospital, but at one of more than 5,600 surgery centers across the U.S. There are now more surgery centers than there are hospitals.
We were watching them work on our boy, and one nurse would talk to us, and then the doctor said it was done.
A federal report shows a paramedic who arrived to treat Ruben received no response from the facility staff when she inquired who was in charge of CPR. In response to a lawsuit, the center and one of its doctors claimed Ruben's death was the result of pre-existing conditions, acts of others, or conditions over which they had no control or responsibility. The case was uncovered by a joint USA Today Network and Kaiser Health News investigation, which suggests surgery centers aren't always prepared for a crisis.
We had reporters in multiple states who were digging through court records, digging through autopsies, digging through EMS records.
Christina Jewett was one of those reporters. Their investigation turned up more than 260 deaths in surgery centers since 2013, ranging from the dozens who've died after routine procedures like colonoscopies and tonsillectomies to at least 14 people who died after more complex spine surgeries.
The majority of the cases go great in these facilities, but what we found was that some of the patients are not appropriate for this setting. They might be too sick. Some of the surgeries might be too complicated, and we also found that sometimes the centers just aren't prepared.
The report shows inspectors have discovered 230 lapses in rescue equipment or training regulations at surgery centers since 2015.
This report is doing a disservice to patients.
Bill Prentice heads the Ambulatory Surgery Center Association, which represents these facilities.
If you took that wider view and looked at the number of adverse events that happen in hospitals compared to surgery centers, you'd see that we're in actually a very safe site of service.
He says the fact that 90% of these centers are at least partially owned by physicians gives them greater responsibility for everything that happens there. CBS News chief medical correspondent Dr. John LaPook works at an outpatient facility that closely follows the standards of a hospital. We asked if patients should worry about doctors' financial interests.
I think if patients are being recommended to an outpatient surgical facility, it's a perfectly reasonable question to say, are you a part owner of that?
And if the answer is yes?
Well, then you have to perhaps go back and forth about, do I really need this? Why am I doing it in this facility versus another facility? Is it just as safe for me to do it in the outpatient setting as the inpatient setting?
Perhaps the most high-profile surgery center death was that of Joan Rivers, who stopped breathing during a procedure in 2014. Her daughter, Melissa, filed a malpractice suit claiming doctors took cell phone pictures of the sedated star and fumbled their response to the crisis. The two sides reached a settlement in 2016. The USA Today Network and Kaiser Health News team had to dig hard to learn about the cases we hadn't heard about.
It shouldn't take a national team of investigative journalists to answer these basic questions. There really should be something for patients to turn to find out what is the safest center in my area.
Prentice agrees we need a better system for reporting problems and a simpler way for patients to compare the price and quality of care.
We're not about trying to hide from, an adverse event, because the only way you're going to learn from it and improve it and make sure it never happens again is by making sure people know about it.
Now, of course, there are risks associated with any procedure wherever it happens. And if you're considering surgery, doctor or a surgery center, Dr. Lepouk recommends asking about backup plans in case something goes wrong and looking how long it would take to get you to a hospital. If it's a long distance and your underlying health is poor, you might just want to have that procedure at the hospital in the first place.
That's very good advice.
Indeed.
Because I'm sitting here thinking, what do you do? Because you like the cost of it, and you hear people say it's safe, and then on the other hand, when something goes wrong in a routine procedure, that's very scary.
What everyone seems to agree on is that more data is needed to determine which of these are the best centers.
Well, that's the thing. You're always trying to figure out, get more data about your underlying issue itself, and then to have to get more data about where you get that issue taken care of. More complicated.
Very interesting.